It's my breath. Debbie, can I have some help, please?
Oh, Mary, you're very short of breath. Okay. Andrea, her oxygen saturations are very low. Can you start Mary on 100% oxygen, please? Mary, I will call the resident to come and see you. Okay. Hello? Oh, hello, Sarah. My name is Debbie. I'm the qualified nurse looking after a patient called Mary on ward A2. The situation is that she's become very short of breath and wheezy. Her background is that she has asthma and her inhaler appears to be empty. On assessment, she has oxygen saturations of 92% and a respiratory rate of 30. My recommendation is that I have already started oxygen 100% and I would like you to come and assess her immediately, please.
Okay. Thank you, Debbie. I will come immediately to see Mary on ward A2.
Thank you.
Mary, the resident is going to come and see you. We will sort you out.
Hi. Hello. Hello, Mary. My name is Sarah. I'm the resident. I'm going to assess you, okay? Okay. Okay, it's okay. Mary, you are having an asthma attack, okay? And your pump is empty. The oxygen is helping you to breathe, but I would like you to give some nebulizer, okay? Debbie, could you please get Ventolin and Ativan for her on a nebulizer?
Yes, I'll get that now.
Mary, your breathing is much better now.
Thank you.
Good.
Hello, Mary.
Hi.
How do you feel?
Feel better, thank
Yeah,
you.
really?
Yes.
Let me see. Yeah? Yeah, this is much better.
Yeah.
Yeah. Shall we talk about that?
Oh, yeah, yeah.
What shall we discuss to improve patient care? I think the situation was dealt with very well.
Thanks. I was worried nobody was going to hear me.
Yes, I did hear you, Andrea, but I think it would be good for us to discuss our communication and why did Mary deteriorate so quickly.
Let's talk about what happened and analyze it to know what can we improve for the next time. I think it's nice that you both recognize the patient was hypoxic, you gave her oxygen immediately, you called for a help. But did you also know that you could activate the emergency alarm if you need it?
Well, I thought the emergency alarm was for when the patient had a cardiac arrest, but now you've told me I can use it in an emergency, I will feel more confident now.
Debbie, when you were on the phone to me, you talked about Mary's problem using this bar tool. It was very clear and very quick. So I understood that it was necessary to come quickly to give her the correct treatment.
Yes, thank you. Using the S-bar tool helped me to communicate the situation to you easily. The other thing I noticed is that when we call each other by name, we are able to know what everybody is doing.
The thing that was bothering me though was where the patient had an empty inhaler.
Yes, I think when Mary came into hospital, she had her inhaler and she wasn't able to tell us that it was empty. We should have been able to get a new inhaler from the pharmacy.
So what can we learn from this experience?
Well, I think it's important that we check patients' medication levels when they come into hospital.
I thought we worked well when there was a potential emergency situation.
Yeah, I agree with you all, but I also think that verbal communication too helped us to be more effective.
Yes, it did.
So, what actions do we need and who will do them?
Well, I'll get Mary a new inhaler from the pharmacy, but also make sure that all of our other patients have their medications appropriately as well.
Let's keep communication tools.
Yes.
Well, what I was thinking was we could present this as a good news story in our quality and safety meeting next month.
That's a good idea.
Thank you, everyone. This is such a good outcome. We will model this for our patients.
Yes, we will. Thank you.